Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I want to talk about how you can take care of your voice. And so a lot of times we're going to do things to our voice that's going to make it worse, and we can have some hoarseness associated with it. And at times that's going to happen, but we don't want that to be a long-term and regular problem. So what kind of things can we do to help maintain a good voice and to kind of help start to treat hoarseness when it develops? And so with your voice, one of the main things you want to do is maintain excellent hydration. So the more well hydrated we are, the thinner the mucus is, the better the mucosa, which is kind of the skin of the inside of the throat, is going to be, and the healthier it's going to be. So maintaining good hydration can be a key component to helping your voice care. A lot of times we'll see the voice to be worse when someone has some acid reflux, or they're irritating it with external factors like smoking or secondhand smoke or some of those other things that can definitely affect the voice by inflaming the lining tissues in our throat. So our vocal cords are this kind of band of fibrous tissue covered by a layer of mucosa, almost like the things that line the inside of your cheek. And that fold of mucosa vibrates as we make a sound, an E sound, or we're talking basically. And then our mouths and tongue kind of mold that vibration into our spoken words or the sounds that we make. So we want to keep that lining tissue as healthy as we can. So acid from our stomach can get up into the throat and irritate those vocal cords. So, trying to reduce acid reflux by maintaining a proper diet and not eating late and not eating some of the spicy foods or other things that can irritate the reflux can help improve voice quality. I mentioned hydration, but I'm going to go over it again because it's just that important. So you want to maintain good hydration of the vocal cords. You don't want to overuse your voice. So screaming, even whispering can actually be kind of hard on the voice. So we want to talk in a nice, comfortable, conversational tone. We don't want to be overusing and feel like we're straining muscles in our neck that are not meant to help produce voice, but are meant to be in swallowing and neck movements. So we want to use the right muscles and not the wrong muscles. And usually that's something we can just do by talking comfortably. If we need to project to a loud room, then every once in a while that might be all right. But if you have to do it regularly, if you're a teacher or something, you may need a voice amplification system to try to help with that, so you're not overdoing it with your voice all the time. If you're a singer, sometimes seeking out a professional singing coach so that you're not doing the wrong things can be helpful. So there are definitely techniques that can be abusive to the voice if we're overdoing it, and you don't want to get into those patterns and habits. So taking advantage of a voice coach can kind of help keep the voice healthy for those professional voice users. So those are some of the broad things. If you have sinuses or postnasal drainage, that can irritate the voice, so we want to try to get those things handled. Maybe allergy medicines be required or other things, but you don't want to try to use medications that dry you up too much because, again, we need that moisture and hydration of the vocal cords. That's just some general overviews on some voice hygiene things, we call it. So if you have hoarseness and problems with your voice that really aren't improving, if you've got hoarseness over 3 weeks, it probably should be evaluated by an ENT physician. Appreciate it. Thanks for listening.